I can give a whole chapter about the USAID funded support that I have got. First of all, the capacity enhancement to me as a probation officer has been immense. I was trained, I was given immense training, in-service training in child protection. USAID organized a leadership training for all the local and district leaders from the lower local governments, and then the councillors at the district, the local council 5, the DEC members, the COW, the town clerks, the planner, such critical leaders in the district, to enlighten them and interest them in the work that the probation office does. I want to applaud that training because it became a turning point in my office. Since then, my funding, though small, was increased from 0 to now about 800,000 to $1 million per quarter. It's not something cheap. And it was because the local leadership now appreciated that actually this office needs support. The other critical area is the development of data and management of data and the utilization of this data to now be translated into something that my office can use to demand for services, to demand for anything that I would see is better for my office. SAIDs came to be very visible with us. It is from that time that we learned actually that a CDO can be felt, can be seen, can be heard at a community level. And it is from that time that we were taken through the data collection, the reporting quarterly, then the knowing who you have worked with and where, and how we could now report about what we have worked, and then again go back and manipulate this collected data, translate it into usable data that now we can share with the different stakeholders and actually show that evidence is needed to be worked on, because this data that we have from the sub-counties would actually highlight the vulnerabilities that the children suffer in their magnitudes. When we come to customizing the problems that we have as a probation office, now how the community development officers work with the families, work with the children, work with the young people, work with the stakeholders in the community, now there we are scoring it, because we were able, for instance with SOSI, we were able to move to the communities, do community outreaches, and then alongside we would do community clinics. I go to the field, address the community stakeholders, raise a lot of issues there, then I now look at individual cases. We have done that because we were guided, because we were taught on how to do that. And when we also go to the communities, we have done case conferences. This was done with SOSI, it is now, it cascaded. Yes, AVS is supporting us to do that. We gather at the sub-counties, the different stakeholders come, they raise those pertinent issues, we share with them, we find a way forward, we depart when every person knows their role, knows how to solve this. And then here at the district, we have an umbrella child well-being committee that brings together different stakeholders, those that are very key to the child protection service area. We look at the education officer, the district health officer, we look at the planner, because all this that we do, we must have a planner helping us to deliver this service. And then we look at police, the child and family protection unit, very key, very critical. Then we look at the remand home. It receives our children, 12 years to 17. What happens to them when they are there? Then police has a lot of roles it plays. The gender-based violence, the sexual and gender-based violence desk, it is very critical in helping us to follow up with the perpetrators, to handle the victims of sexual violence. All those are there. And we sit every 3 months. we evaluate ourselves, we report, we share experiences, we share these reports, we look at where the challenge is. Together, we look for a solution. This is the work that has been going on. Yes, and we so very much want to applaud USAID to making this effort real, sustainable, because throughout the period we have had this go on.